Hello everyone, welcome back to the new episode of Doctor's Quiz. Let's learn reflexes of babies through today's MCQs. And if you are visiting my channel for the first time, please click the subscribe button to learn medical subjects through quizzes. So are you ready to learn? Let's get started. The first question is, an involuntary reaction happens when a baby is startled by a sudden noise or movement, or when they feel like they are falling. The baby will extend their arms and legs, then quickly bring them back to the center, often accompanied by crying. What's the name of this reflex? Options are fencing reflex, crawl reflex, Moro reflex, or tonic neck reflex. Here the correct answer is Moro reflex. Usually, Moro reflexes disappears within 3 to 6 months after their birth, and which helps the babies to develop their skill in controlled walking. The next question is the dorsiflexion of the great toe with or without fanning of the other toes, and with trial of the leg on stroking the bottom of the foot of the baby. What is this reflex called? Options are crawl reflex, Babinski reflex, parachute reflex, or Landau reflex. The right answer is Babinski reflex. This reflex will disappear between 12 to 24 months of their age. If the Babinski sign is positive in a baby, it indicates that baby is having good neurological responses, as well as the brain and nerve activities of the babies are well and good. The next question is, when cheek or the side of the mouth is touched or stroked, the baby involuntarily turns his or her head and open mouth to follow the direction of stroking. What is this reflex called? Options are rooting reflex, milk ejection reflex, suckling reflex, or swallowing reflex. The right answer is rooting reflex. Usually rooting reflex disappears between 3 to 6 months, and which helps the baby to find out the nipples. The next question is the reflex in which babies involuntarily pushes their tongue forward when something touches their lips. What is this reflex called? Options are tongue toast reflex, suckling reflex, swallowing reflex, or fencing reflex. Here the right answer is tongue thrust reflex. Usually this reflex disappears by 4 to 6 months, and this involuntarily protects the babies from choking and aspirating their food. The next question is, if we stroke the skin along one side of the baby's spine, the child will flex the hips and move towards the stimulated side. This reflex is known as. Options are fencing reflex, Gallant reflex, startle reflex, or crawl reflex. The correct answer is Gallant reflex. This usually disappears between 4 to 9 months of their age and helps to create wide range of motion in their hip, and this in turn prepare the spine of the baby for their crawling and walking movements. The next question is, when your baby is lying down and their head is turned to the right or left, the corresponding arm extends while the other arm bends next to their head. This reflex is known as. The options are grasp reflex, crawl reflex, Paris reflex, or tonic neck reflex. Answer is tonic neck reflex. This reflex disappears between 5 to 7 months, and it helps babies to discover their hands, and also it will develop their hand-eye coordination. The next question is, if you stroke in your baby's palm, they will grasp your finger. This reflex is known as. Options are crawl reflex, Landau reflex, parachute reflex, or grasp reflex. answer is grasp reflex. This reflex usually disappears by 3 months and it helps the babies to clench the objects when pressure or touch is applied to their hands. The next question is, if you hold a baby in upright position and place their feet on a flat surface, and they will appear to take steps and walk. This reflex is known as, options are Landau reflex, parachute reflex, stepping reflex or Perry's reflex. The answer is stepping reflex. Stepping reflex is also known as dancing or walking reflex, which usually disappears around 2 to 3 months of their age and which helps baby to prepare for walking by strengthening their leg muscles and familiarizing them with the movements. The next question is, if you touch the roof of the baby's mouth, they will start to suck. This reflex is known as, options are Landau reflex, sucking reflex, swallowing reflex or crawl reflex. Answer is sucking reflex. This reflex will stay until their infant age and it helps babies for breastfeeding. And the next question is, if you place a baby horizontally in air in the prone position, automatically they elevate their head and slightly flex their legs in a convex arc. This reflex is known as, options are parachute reflex, crawl reflex, Perry's reflex or Landau's reflex. Here the right answer is Landau's reflex. This reflex usually disappears between 12 to 24 months in babies and it helps babies to develop their muscle strength in their neck, back and core, and also it helps to process their vestibular balance and oculomotor skills. The next question is, if you touch the cornea of the baby, involuntarily they close their eyelids. This reflex is known as, options are blinking reflex, pupillary reflex, Perry's reflex or conjunctival reflex. The right answer is blinking reflex. This reflex helps to protect the eyes of the babies from lights and foreign bodies. The next question is, a reflex in infants that causes their eyes to move in the opposite direction when their head is turned. The name of the reflex is, options are tonic neck reflex, pupillary reflex, parachute reflex or doll's eye reflex. The correct answer is doll's eye reflex, which is also known as oculocephalic reflex and disappears around 3 to 4 months, and it indicates that the brainstem function of the baby is good. The next question is, place a pointed cotton into the nostril of a baby and slightly move the cotton here and there. Immediately the baby will respond by sneezing. This reflex is known as, options are blink reflex, parachute reflex, sneeze reflex or Perry's reflex. The right answer is sneeze reflex. This reflex acts as a protective mechanism that helps clear the nasal passages of irritants and ensure clear breathing in babies. The next question is, when bright light falls on baby's eye, the pupils constrict immediately. This reflex is known as, options are pupillary reflex, corneal reflex, photoreflex or fencing reflex. The correct answer is pupillary reflex. This reflex helps to assess the functionality of the nervous system, particularly the brainstem and cranial nerves involved in vision and light response. The next question is, if you tap the forehead of the babies in between the eyebrows, the child will blink their eyes. This reflex is known as, options are blinking reflex, conjunctival reflex, Perry's reflex or glabellar reflex. Here the right answer is glabellar reflex. The next question is, a primitive reflex in infants where pressure on the palms elicits a response of mouth opening and often flexion of the forearms and head. This reflex is known as, options are parachute reflex, grab reflex, Babkin reflex or sucking reflex. Correct answer is Babkin reflex. This reflex disappears by 5 months of their age and it helps babies with breastfeeding by stimulating the breast to increase milk flow. The next question is, when the child is held upright and the baby's body is rotated quickly to face forward as in falling, the baby will extend their arms forward as if to break a fall. This reflex is known as, options are landau reflex, grasp reflex, crawl reflex or parachute reflex. The correct answer is parachute reflex. This reflex is a protective response that helps infants brace themselves when they feel like they are falling. The next question is, if your baby is placed on their stomach, they will pull their legs under their body and kick them out in a crawling motion. This reflex is known as, options are stepping reflex, crawling reflex, Perry's reflex or landau reflex. The correct answer is crawling reflex. This reflex disappears within 4 to 6 months of their age and it is very important for developing bilateral coordination and preparing the baby's brain for higher level functions. The next question is, if you tap the tendon just below the kneecaps of babies, they immediately respond by producing kicking movement by their lower legs. This reflex is known as, options are stepping reflex, Babinski reflex, fencing reflex or patellar reflex. The correct answer is patellar reflex. This reflex helps in babies to assess the function of the nervous system, particularly the spinal cord and associated nerves. The next question is, the reflex in babies in which the muscular contraction of the back of the throat evoked by touching the roof of the mouth, back of the tongue, area around the tonsils, uvula and back of the throat. This reflex is known as, options are pharyngeal reflex, cuff reflex, landau reflex or Perry's reflex. The right answer is pharyngeal reflex, which helps the babies to clear the airway by expelling foreign objects and preventing them from entering the lungs. The next question is, which reflex is characterized by the baby extending their body, lifting their head and tilting their pelvis when the spine is stroked firmly from tail to head? Options are fencing reflex, parachute reflex, startle reflex or Perry's reflex. The right answer is Perry's reflex. It disappears between 2 to 6 months and it indicates the neurological developments of the babies. The next question is, touching the sole of the baby's foot causes their toes to curl downward. This reflex is known as, options are palmar grasp reflex, plantar grasp reflex, Moro reflex or fencing reflex. The correct answer is plantar grasp reflex. This presents typically from birth until around 6 to 12 months of age, and this reflex is used as a clinical indicator to assess the neurological development and potential abnormalities in babies. Yes, that's all for today's video. Hope I have included most of the reflexes in this video, and if you think my video is helpful for you to learn, please like and share it with your friends. And I will meet you in another episode on coming Friday. Until then, bye-bye. Take care.